Hey, I'm Anastasia. This is Anastasia's Hump Day Happenings, and October is Breast Cancer Awareness Month, and I'm going to share with you 3 topics to discuss if you are a breast cancer patient, so you can kick cancer's butt. So first, let's go with the treatments or the therapies. Chemotherapy, it could be radiation, IV bisphosphonates, or an oral medication. Chemotherapy. So oral mucositis would be a side effect or an oral complication. Your mouth is red. It is angry. It can be seen as early as 5 to 10 days starting chemotherapy, and it can last as long as 14 days. It is painful. It is like red sores, ulcers. It makes it difficult to speak, drink anything, and eat. And you need to keep your nutrition or immune system up. Another one is xerostomia. Xerostomia is dry mouth, and generally we've got to have your spit. Your spit is amazing. It should be clear and bubbly like Prosecco or sparkling water. It's got antifungal, antiviral. It's got enamel building properties in it, and it helps to digest your food. You've got to have it. A fungal infection, is another thing to look out for. Gingival bleeding and periodontal infections, all from chemotherapy. Burning mouth syndrome, another thing from chemotherapy. The second treatment would be radiation. Xerostomia is the #1 oral complication. IV or bisphosphonates can be associated with osteonecrosis, and that is death of bone. Not a good situation. We usually see it in the mandible or the lower jaw. So ask questions. Now let's go into medications, because that's really what's going to affect the bone mineral density testing. And it's going to depend on 2 things. #1, the class of drug that you are using, and #2, what stage of life are you in? Are you premenopausal? Are you postmenopausal? So premenopausal women, if you are battling breast cancer, know this: you may be taking Tamoxifen, which has an increased risk for reduced skeletal bone. Increased risk for reduced skeletal bone, and side effect is going to be jaw pain, in addition to most of the chemotherapy oral complications that I just addressed. Let's go to postmenopausal women, breast cancer patients. If you are taking Tamoxifen, oddly enough, it has a minimal impact of reducing your skeletal bone. Minimal impact. That would be Tamoxifen. Some of you may also be taking AIs, which are aromatase inhibitors. The #1 medication I found was Arimidex. You are also at an increased risk for musculoskeletal issues. 50% of breast cancer patients, 50% of you are experiencing joint pain, wrist pain, hand pain. You cannot floss. It's going to be difficult, let alone using a toothbrush and effectively remove the plaque. What are we going to do? Here's our solution. We are bringing it home. #1, you want to make sure that you connect. If you are a breast cancer patient, you want to make sure that you connect with your dental professional, your oncologist. Everybody on your team should be connected, because you may need an oral rinse. It may need to be prescribed for you, because if you've got oral mucositis, burning mouth syndrome, or if you're at a high risk for tooth decay, we need to make sure that you have a target-specific oral rinse. So don't go over the counter, just grab anything. You want to make sure that this is targeted for you, which leads me to #2, toothpaste. Not all toothpaste are the same. Are you at a higher level for tooth decay? Do you have xerostomia? If you have burning mouth syndrome, sometimes sodium lauryl sulfate, or SLS, can be more harmful in a paste than helpful. So we've got to make sure that we are target specific. Do you already have tooth sensitivity? So in addition, if you've got gum problems, stannous fluoride may be an option for you in a paste over sodium fluoride. Just know, or any fluoride at all, you have to know your options of what's going to be healthier for you at this time. #3, if you are experiencing musculoskeletal issues, please get an electric or power toothbrush. Oral-B Genius is what I would recommend, or Oral-B 5000 would be another one. Ask me more questions about it, or I'm happy to guide you to their professional site. And then finally, discuss nutrition. Nutritional options that are good for your immune system, and nutritional options that are going to be good for your oral health. That can be taken from a smoothie. So get together with, whether it's a holistic nutritionalist, your dental hygienist, and make sure we're all on the same page. So I hope this helps you out in identifying there's treatments, then there's side effects from oral complications due to those treatments, and that's going to depend upon if you're taking medication, to the stage of life that you're in. Are you premenopausal? Are you postmenopausal? And what are the side effects of that, and how will that impact your health? Now, you got a question for me? Ask it. #AskAnastasia. Like this channel, it does matter, so you can join me every single week. And until next Wednesday, take what you learn and make a difference with it.